Bismillahirrahmanirrahim. A 63-year-old man present with acute upper abdominal pain present for several hours. The findings on chest X-ray are illustrated here. This is the X-ray chest we can see. Which one of the following is most likely explanation for his presentation? So for several hours, the 63-year-old man present with acute upper abdominal pain. So the options are the subphrenic abscess, ruptured esophagus, perforated peptic ulcer, emphysematous cholecystitis, gastric volvulus. Here is the X-ray. Unless the patient is within the first 48 hours after laparotomy or laparoscopy, finding free intraperitoneal subdiaphragmatic gas as illustrated is most likely due to a perforated peptic ulcer. So this is the case of the perforated peptic ulcer. Here we can see the air and fluid level, subdiaphragmatic gas from perforation. So most likely diagnosis in patient as described presenting with acute upper abdominal pain is this perforated peptic ulcer. Occasionally, a subphrenic abscess may show a focal localized collection of gas above the lower with a fluid level. An air fluid level on the left would need to be differentiated from the normal stomach shadow with contained gas and fluid level. Here we can see this gas and fluid level. Esophageal rupture usually occurs at the level of subdiaphragmatic lower esophagus to give intrapleural mediastinal or subcutaneous gas. This esophageal rupture, also called as Boerhaave syndrome. Emphysematous cholecystitis causes localized gas within the gallbladder wall associated with anaerobic gas producing organisms such as Clostridium welchii. Gastric volvulus can give an air fluid level in an abnormal position within the trapped and twisted stomach, but this should not be mistaken for free intraperitoneal air. So the answer is perforated peptic ulcer. A 45-year-old woman had a lumpectomy, postoperative radiotherapy, adjuvant chemotherapy, and tamoxifene therapy at the age of 42 years age for an estrogen receptor positive breast malignancy. She was prescribed tamoxifen in a dose of 10 mg per day and was to take it for the next 5 years. From the time she completed her chemotherapy 3 years ago, she had no menstrual periods until 1 week ago when she had an episode of light vaginal bleeding lasting for 7 days. She is still taking the tamoxifen. Which one of the following most likely cause of her recent bleeding? So this is the case of breast CA. She is on the tamoxifen and now she had vaginal bleeding which is lasting for 7 days. So options are induction of a follicular development by tamoxifen, endometrial polyp formation due to tamoxifen, and endometrial cancer produced by the tamoxifen, endometrial atrophy due to the tamoxifen, and endometrial metastasis from the breast cancer. So these are the options. Which one of the following most likely cause of a recent bleeding? Why there is the bleeding which she had for 7 days. Uh, she's taking this tamoxifen. Due to increasing incidence of breast cancer and the efficacy of tamoxifen in preventing the disease of high-risk patients and reducing the recurrence rate in women with estrogen receptor positive cancer. Tamoxifen is now being given to many women, especially where the cancer occurs premenopausally. Like any therapy, there are potential risks and side effects. These risks include endometrial polyp formation, subendometrial edema, and rarely endometrial carcinoma. So these three are the patient would be on the risk of these three disease like endometrial polyp formation, subendometrial edema, and rarely endometrial carcinoma. A polyp or carcinoma can cause a uterine bleeding, with a polyp being the most likely. So option B is correct, which is endometrial polyp formation. Although routine endometrial thickness screening is not recommended in all women taking tamoxifen, if abnormal bleeding does occur, ultrasound assessment of endometrial thickness and hysteroscopy and curettage are indicated to assess the endometrium in more detail. Tamoxifen is not a cause of endometrial atrophy. Endometrial metastasis from a breast cancer is rare, and tamoxifen would not usually induce a follicular development in a woman who has had a chemotherapy and has amenorrhea as a result. So, the endometrial polyp formation is one of the side effect of this if female who's taking a tamoxifen for longer time. But remaining side effects are also there, but are very rare, which is subendometrial edema and endometrial carcinoma.